experience stomach problems, right? But how do you know if it's just a cramp or something real serious? We're talking to Dr. Thompson about irritable bowel syndrome and what you need to look out for. No worries. All right, a lot of people deal with stomach issues, right, during their life. But how do you know if it's something like maybe just cramps, gas, or maybe something more serious like irritable bowel syndrome? April is, in fact, IBS Awareness Month. So joining us this morning to talk about the signs and the symptoms so we know more about it, we have Dr. Sharon Thompson from Central Phoenix Obstetrics and Gynecology. Thanks for being here this morning. Morning. That's the biggest thing because stomach issues are sort of normal, right?
Stomach issues are so common and often overlooked. And I think that one of the things about IBS is because it relates to your stomach and going to the bathroom, people don't want to talk about it.
Sure.
And so people suffer with their symptoms for a long time. I think one of the things that's so important is if you have any symptom that's lasting more than a week, and that's not normal for you, you should go get it checked out. Right. So
what would you be feeling? I guess what are some of the cramping?
So some of the symptoms of IBS, and there are many, and that's why sometimes it can be so hidden, is because it can be feeling gassy or bloated. Diarrhea, constipation, pain. So any constellation of those symptoms that last more than a week, and that's not your normal, you should go talk to your doctor about it.
What can be done when you're dealing with IBS?
So IBS is a very complicated disorder. We have talked on this program before about how your gut has a nervous system all on its own. And the point of that nervous system in your gut is to recognize foreign things, kick them out, and keep what's healthy. Well, sometimes that goes awry, and your nervous system recognizes things that are not unhealthy, garlic or wheat or milk proteins, and it responds to those as if they're problematic. And so you get a lot of the same symptoms as if you have an infection, but you don't.
That's why it is sometimes hard to diagnose, right?
It is sometimes hard to diagnose.
Looking at it and I guess logging is also important, right?
Logging
to see what's happening and when it's happening?
Exactly. And so one of the most important things is that you're going to have to change what you do. Change how you eat, how you move your body, and sometimes IBS symptoms can be associated with brain symptoms, things we think anxiety or depression. And we don't know if it's the anxiety or depression.
I was going to say, does one cause the other?
Causing the other one, or if people have some underlying thing that makes them prone to both. Because remember, there's a big gut, there's a big nervous system in your gut. So sometimes we use medicines for anxiety or depression, and they really help with the IBS symptoms.
Are there any more certain people who are prone to IBS?
Well, women are more likely to get it. Women are more likely to get almost every disease that's associated with your immune system. And our gut is a huge part of our immune system.
We just have weaker immune systems?
It's not that we have weaker. Our immune systems are different because one of the big challenges a woman's immune system faces is carrying a baby. So it's set a little bit differently. And so it's more sensitive, I like to say.
All right.
Yeah.
All right.
So you definitely want to talk to a professional. There is help out there for you. You don't have to suffer in silence. So definitely talk to your doctor about it.
Okay. So again, if it's a week of similar symptoms that you normally don't have.
Absolutely.
Dr. Thomas, we always appreciate when you give us the lowdown on that. And we have a very special good morning. We have a little guest here.
This is my niece. She's hanging out with me today. And she's going to say hi to some people. Look right over there.
Who do you want to say hi to?
My mom,
your mom,
my grandma, and my cousins.
Very good.
So wave, say hi. Good morning. Thanks for coming with me today.
So fun. All right, we made it a national Take Your Niece to Work Day. I like that. Thank you very much, Dr. Thomas.
Sorry
Always
for my
great
voice
information.
Today.
Yeah, I was going to say, now you need to go take care of that voice. Allergies are bad right now.
You're suffering too, I'm sure.
All right, and then I'll just keep talking to you, so you have to keep talking.